Surgical Diagnostic Drone Program 0.x2 initiating. Navigation Module online. SAD online. VR Module online. Scan Module online. Sonar online. Bioreactor online. Bioimpulse engine capacity 100%. Drone is ready for diagnostic. Leaving MIDD. Attachment of the medial meniscus. Transverse ligament. Attachment of the anterior cruciate ligament. Anatomical scan. Approaching the intercondylar eminence. Lateral intercondylar tubercle. Posterior cruciate ligament. Anterior horn of the lateral meniscus. Anatomical scan. Arriving at the lateral tibial condyle. Lateral meniscus. Anatomical scan. Function of the meniscus. The meniscus distributes the load between the femur and tibia, functioning as a shock absorber, and protects the articular cartilage. Anatomy of the meniscus. A meniscus is a crescent-shaped fibrocartilaginous anatomical structure. Generally, the term meniscus is used to refer to the cartilage of the knee, either to the lateral or medial meniscus. Both are cartilaginous tissues that provide structural integrity to the knee when it undergoes tension and torsion. They are concave on the top and flat on the bottom, articulating with the tibia. They are attached to the small depressions, fossae, between the condyles of the tibia, intercondyloid fossa. Towards the center they are unattached and their shape narrows to a thin shelf. Cross-sectional anatomy of the meniscus. The superficial and intermediate zones consist of type 2 and 3 collagen providing protection to the circumferential fibers that provide hoop stresses, as long as attached to bone anteriorly and posteriorly. Circumferential fibers are type 1 collagen. Meniscal vascularity is segmented in 3 categories. Red zone. Peripheral, 3 mm, excellent blood supply. Best biology, worst biomechanics. Red-white zone. Central area with variable vascularity. White zone. 5 mm from periphery, avascular area. Worst biology, best biomechanics. All 3 zones are needed for ideal meniscus function. Radial tie fibers attached to meniscotibial ligament. Circumferential fibers are type 1 collagen. Anatomical scan. Collagen structure of the cruciate ligaments. Collagen strand bundle. Single strands. Collagenous fiber. Fibril. Subfibril. Microfibril. Collagen molecule. Polypeptide chain. Approaching the medial condyle. Medial meniscus. Medial femoral condyle. Anterior cruciate ligament. Attachment of the posterior meniscal horns. Anterior cruciate ligament. Attachment of the anterior horn of the lateral meniscus. Autopilot engaged. End of surgical diagnosis.